So today I am with Vicki Haines, who is the owner of Atomic Dermatology, and you are a dermatology provider?
Yes, sir.
Very good. And how long have you owned your business, Vicki?
I have been here for 2 years. I've been in dermatology, though, for 10 years and medicine for 20 years.
Oh, very good. So this is some of the same series that I've been doing for the last 12 weeks when I get to meet with some business owners. And I want to know, when the shutdown of the businesses was first instituted in March, how did that affect your business right off, Vicki?
Well, like I mentioned, I've been in medicine for 20 years. 10 of that was in emergency medicine.
Okay.
So right away, I thought, how do we keep people out of the emergency department and safe? Because I too, listened and thought, okay, this is serious. We've got to keep people safe. I want to keep my patients safe. So we actually changed to more of an urgent care. So we became on call till 7 o'clock every night and open on the weekends too, on call. And our message was, no matter if it's, you need sewn up like a suture, or whether you need, or if you have a rash, but also cough, cold, runny nose, how can I keep you safe? So we did that for the first 4 weeks, and we really, tried to change, what we were doing to help everyone.
Okay. So were you listed like an essential business, or was this that you could, so you could keep your doors open?
So we were open, but we did, a lot of dermatology is elderly people. So about 60% of the people we see are of that demographic that could be more at risk. So we called people that we knew that lived in the nursing homes and said, please stay home. We did telemedicine. So we really tried to listen and keep people protected. But we were essential. We probably saw, I would say, about half of our patient load, though. We didn't lay anybody off, except for our nurse that was an injection specialist that does Botox, because that was not deemed essential. And so we really tried to keep everybody working and everybody busy, and our staff was amazing. They not for 1 minute, were like, no, I'd rather be at home on unemployment. We didn't have any of that.
So now we're entering into week 12. You've been 3 months going under this. Franklin County still stage 1. What do you see in your future right now? Is there any changes that you think will happen if you cannot get out of stage 1, or if we move to stage 2, how will that change for you?
For us, it won't change a lot, except for bringing back our nurse injector, as we mentioned. But we right away at stage 4, at week 4, we noticed that people were coming in with huge skin cancers. So we really, then said, no, you need to come in. We can't do telemedicine with dermatology. We really need to have people in. And what we're seeing is with staying in this stage 1 and staying like this is that people are really not doing the things they should do to stay healthy. And so this is really going to affect people's health in much bigger reasons than just the COVID. So people aren't getting their breast exams. People aren't getting their colonoscopies. People are scared to go to their doctor. And that's why we've got to open up. So people can be responsible for their own health again. We're going to see that people, I've talked with many cancer doctors. I've talked to, people at the Cancer Center, Dr. Jones. I've talked with Dr. Lewinda at the Northwest Cancer Clinic. And we all agree we've got to move on. We've got to do it in a safe way. People have got to govern themselves. They've got to, people can trust in themselves, know that people want to be healthy. If you're immunocompromised, if you're elderly, stay home, have people still buy your groceries, wear a mask in public. If you're young and healthy, don't have huge raging parties. Everybody stay healthy, drink less alcohol, visit the pot shop less, do things to keep yourself healthy. That's what we need to do. We don't need somebody to tell us what to do. And I really feel like, Governor Inslee really made a great point yesterday. And that was that the numbers in Yakima County now are as high or higher than when we started.
Right.
So what are we doing still? Everybody's at home, businesses aren't doing anything, but yet we're still in stage 1, where people who, they can learn. My friend owns Mani Pedi in Walla Walla. She does nails and she does toes. People feel safe to go to their doctor because they know their doctor knows how to clean and disinfect and do the things that they need to do. Cherish learned. She learned to do those things. Her patients now, or customers now, feel safe. They feel more like a patient. They feel that she knows how to clean and disinfect. They feel safe that she's wearing a mask. Let people learn. The reason why medical people people feel safer with them is because we learned.
Mm-hmm.
Everybody can be taught. Every hairdresser can do a better job. Everybody can do a better job of being cleaner and more disinfected and wearing a mask. And that's the way we have to move forward. We can't stay closed any longer. There's
Right.
too many livelihoods at risk.
So Vicki, in talking to you about this, it sounds like there's a lot of businesses like yours and others, whether it's salons or a lot of these small businesses, that are being proactive and moving forward. Even though you're in stage one, you are doing the things to move on. Could you just elaborate, please, on that?
Yes, everybody believes this virus is real. Nobody doesn't believe that. Everybody knows what we need to do. So let them do it. Let them be taught that this is how you clean, this is how you wash your hands, this is how you wear a mask. These are the spaces they need. Whether it's Bikram yoga or a gym, or everybody knows what they need to do, and give us the guidelines and let us open, because people care about other people. We all care about each other, and we all want people to be safe. And for the people who don't feel safe, you have the right to stay home. You don't need for other people to not have a business to feel safe. You can stay home. Everybody has that right.
Vicki, I want to thank you so much for sharing that, because you're in a very, your business sees a lot of people, and your cleanliness is important, and you
Very.
know that. Thank you very much for spending your time with me
You're
this
welcome.
afternoon.
Thank you.